How frequently does your board hear from clinical leaders within your organization, and in what capacity? Does your board currently have at least one physician or quality champion serving on it? How do you communicate and interact with clinicians regarding quality improvement plans, policies, and how do you ensure clinicians achieve quality goals?
Engaging clinicians in harm prevention activities does not stop with their participation on design teams or even implementation teams. Prevention of harm practices need to be incorporated into their daily practice. Nurses, physicians, and other clinicians should feel free to demand high performance from each other and call them into account when procedures are shortcut or when clear safety measures are mishandled.
We invite different departments from the hospital to come and present to the board exactly what are they doing, what are their goals and what are their objectives, where are their shortcomings, and how we can be more active in that. In the process, we're able to engage the physicians and engage the other members of the staff, and it's also challenging to the other departments in the hospital for them to one day be asked to come and report to our board as to what they're doing to not only increase the awareness, but to enhance our ability to do more with quality.
One of the great opportunities that exists when a board includes physicians, nurses, or other clinicians is that one can really create a very tight linkage between board management and the clinical staff of an institution. That means that a healthy relationship that is open to discussing shortcomings or opportunities and addressing those opportunities meaningfully through change programs can occur.
So one of the best ways that a board can engage with the frontline caregivers is by doing rounds. The opportunity for a board member to get out of the boardroom and to get onto the clinical unit where the nurses and the frontline clinical caregivers are and where they're doing the work that healthcare is all about is a really beneficial experience for both the board member and for the nurse and the clinical caregivers at the bedside. It allows a board member to truly see what the day-to-day activities are like and what the clinical staff is dealing with as they try to take care of patients. And on the other hand, it also allows the nurse to see that those that are at the highest level in the organization, setting priorities, setting strategy for the organization, really care about what they're doing and take the time to get out on the floor and experience that. It truly is an organization-changing activity if the organization takes time and really does it right.
It's a healthy indicator when a hospital or health system, leadership team, board, and the clinicians can have a candid and open conversation about their measured performance. The truth is, our care has always been accountable. We've always been accountable to patients and their families, to our communities. But that accountability is very public now. Our performance is measured. It's really appropriate in today's day and age that boards and leadership teams have open, frank, candid discussions with the clinical staff about performance in different areas.
For many boards, engaging in setting quality and safety goals can be quite intimidating. Because boards don't necessarily have a clinical background, setting goals with clinicians becomes extremely important. Boards should engage the clinical leadership of the organization to understand what is possible for the organization to achieve and to set the priorities for those activities for the organization.
Physician engagement in the process of improving quality is absolutely essential. And we've done that in a number of ways. We've done that through engaging them in the process, educating them on the outcomes, helping them understand the decisions that they need to make. We've also resourced them with best practices, and we've resourced them with evidence-based standardized order sets, for example. But ultimately, they've got to embrace this. We've got to have physician champions and key service lines that lead the charge, involving them in the process. Open communication, reward and recognition, having input in decisions are very important to driving that improvement. You know, it's one thing to talk about, it's another thing to put your money where your mouth is, and so there's opportunity, downside or upside, to have recognition of quality and outcomes.
It can be very helpful to have a physician on a board. A physician can be a terrific resource to bridge between the clinical staff, between the voluntary medical staff, and hospital management and board leadership. A well-rounded board brings many competencies. Certainly, many community members have financial competencies and leadership competencies. Given the role of healthcare organizations, the opportunity to bring clinical competencies really rounds out the team. And here's the truth. Hospital boards, healthcare system boards are responsible not only for maintaining practice within the law, for financial performance, but they are legally obligated to the responsibility for clinical performance. So having clinicians as part of a board team is a terrific asset to continue the discussion to areas where boards may have had some historic discomfort and really turn the attention to improvements in quality, safety, that not only offer benefit to the patients we're privileged to treat, to the community, but really assure the future status of the hospital. And it's great when there are clinicians on the board because those individuals can help to interpret those data and can help to connect any areas of opportunity to strategies that would be appropriate for the institution to make improvement and provide better patient care. It's great when there are clinician champions, individuals who are respected, who bring the evidence, and who have the standing among their colleagues to really help move an organization forward in addressing opportunities in safety and quality. Those individuals should be celebrated. It's great when a board recognizes those individuals.
We're a large perinatal center with about 8,500 deliveries a year. And I believe the genesis of the movement to stop early inductions came really from our nursing staff. So I love this example of being lower cost and higher quality all at the same time. So we engaged our medical staff. The medical staff leadership started working on policies and procedures. It took about a year to pull these, they're called bundles, together and to get the medical staff involved. And we had a few physicians who really decided they wanted to champion the effort. At one meeting of our board, we have a physician who is an OBGYN, and he has been very involved in the perinatal collaborative. And he said, it is time for the board to stand up and take action on behalf of the patients and that we serve in our community, and we need to put a hard stop on this. The board took a position on hard stop, and we did it the very next month, and it's been a wonderful success.
So when a board is setting and monitoring quality goals, it's very important for them to hear from nurses and from frontline caregivers. The frontline caregivers are the folks that are at the bedside the majority of the time and who really have the opportunity to impact the care that's given. And so if they're informed and aware of the goals that are set by the board, they're best able to engage and to impact those goals and the culture of quality within an organization.
I think we all realize that there are times when a board or a leadership team might want to make change, and that change meets with resistance, maybe resistance among physicians such as myself. It's really the role of the board and really an opportunity for physician board members to rise as leaders and help communicate the larger goal, the more important purpose. It's great when the clinicians are championing administrative challenges and the administrators have been really part of a conversation about clinical priorities with physician and nursing and other clinical leaders to be able to champion those.
Boards and hospital or health system leadership should have reliable, ongoing mechanisms to communicate and engage with clinicians about quality. Boards should have physician members or possess the clinical competencies to truly understand and track performance improvement. Identifying and working with clinical champions should be a tactic boards employ to improve quality and enhance clinician support and engagement.